Шановні гості, ми розпочинаємо за півхвилинки. Я не бачу наших спікерів. Хто спікери, проходьте, будь ласка, займайте місця.
It's November 27. Ukraine Media Center starts its operation. My name is Liudmyla Shemelinets, and now we're going to discuss the results of the nationwide study, Ukrainian state funding, covering costs for raising children deprived of the parent care. Now we find out that the state currently covers about 50% of the actual costs. And now let me introduce our guests. Joining us are Anastasia Osacha, the head of the children's organization SOS Ukraine, Darya Kasyanova, program development director at SOS Children's Villages Ukraine and chair of the board of the Ukrainian Child Rights Network, Iryna Tulyakova, head of the coordination center for family upbringing and child care development. Also joining us is Valentina, Zozulia, head of the State Service of Ukraine for Children's Affairs, and Leonid, Lebediev, head of the Change One Life Ukraine Charity Fund, chairman of the board of the Ukrainian Association of Adoptive and Foster Parents, and the foster parents raising 6 children. Good morning, all. So, Ms. Anastasia, before we proceed to the results of the survey, key insights and conclusions, can you tell us why did the organization decide to study this matter? What was the goal? Thank you for your question. Our organization, SOS Children's Villages, keeps working in Ukraine for 24 years and more than 60 years global wide. And our goal is to make sure that children grow in the proper environment, and in coordination with the partner Coordination Center for Family Upbringing and Child Care Development, we initiated this survey. This is a survey under which the children were studied that are deprived of parent care. We've invited for this survey InfoSapiens, and the survey was taking place starting from July to November 2025. So what have you been able to find out? First, I would like to mention that the strategy to ensure the right of all of the children to get raised by the families contemplates that 95% of the children deprived of the parent care are supposed to be growing up in the families. And to implement this goal, we have to have motivated parents. And when it comes to motivation of the parents, we were describing it in the quality part. A lot of parents are motivated by the value components, and as you can see, about 30% of the parents were thinking about suspending this family form of education based on the mostly financial reasons. And also I would like to pay attention to the goals that we want to advocate based on the study we conducted. What we want to prevent is the children's poverty, ensure the proper and worthy level of life for the children. The survey and the study was taking place in 3 stages. We were analyzing the legislation, we were analyzing the statistical data and the existing studies in Ukraine. The quantity stage included the survey of the foster parents, guardians, and the parents, As you can see, we covered about 400 respondents. Talking about the quality stage, it included interviews with 5 experts, interviews with the parents, and interviews with the children themselves with account of their interests and necessities. Talking about the methodology of this study, I would like to pay your attention to such important parts. Well, the methodology was of a complex nature. It was comprising of a number of issues. We were trying to identify the spending basket for each child and the costs of integrated services. And in the process of this survey, we were taking into account, first of all, monthly expenses, regular expenses, and non-regular expenses. And then we were trying to find out the mathematical average. And it's important that this cost basket is difficult to identify the amount of money spent for the children depending on their age. When all of the respondents were providing information, they were mentioning the total costs. The same applies to the children with disabilities, because identifying the cost for children with disabilities separately is quite difficult. I think it's a part of the methodology. You will be able to see the methodology in detail in our report, a link to which I will provide you later. And as a result, we've identified the approach for the rates to change the amount of normal state aid, standard state aid. Talking about our respondent, 87% of them are women residing in rural areas or small cities. They have private houses. Also, they have their land plots, which is really important that they grow their own produce. Also, they have either basic secondary or professional secondary education or higher education, and 67% of them are married. 71% raise their children with their husbands, and the minority of the children surveyed were before the school age. What's important is the matter of those who have special needs. As we see, it applies to IDPs and the families raising children with disabilities. Quite an important moment is the situation for the time being. As you can see on the slide, we've identified what is the amount of state aid. We were analyzing such types of disbursements as the social aid for a child and the social aid for the child with disability. Also, what we were analyzing, the remuneration paid to the foster parents and the guardians. Well, now the amount of this aid is tied to the subsistence level, and it's important. You can see the amount of subsistence level. It's really small, and to identify it is being multiplied at certain rates. Talking about an aid for a child, it's 2.5, and for children with disabilities, it's 3.5. But the subsistence level is devolving. Back in 2016, the subsistence level was amounting to the minimum wage. Now it's only 38% of the minimum wage. What's also important that the subsistence level has increased 40%. Meanwhile, the prices have grown 80% within the period until year 25. What's also important is that the Ministry of Social Policy analyzes and identifies the actual subsistence level. As you can see this comparison in the chart, this amount is almost 3 times bigger. So basically, an aid for a child is about 85%, and for the children with disabilities is 84%, which is an important thing for us. Very important is to mention what the families are saving. And first of all, I would like to pay your attention to the first thing. 57% of the respondents save on meals, and 80% keep saving on meals permanently. Also, 23% of the respondents unfortunately save on the medical needs of the children, and 38% save on the clothing for the children and in order to cover the needs of their children, they try to deprive themselves of something. So I would say they don't have any government aid whatsoever. They're not getting them. So how did we identify the real needs for the children in the families? It was happening in the following way. The families were asked what are the costs for the children in the families. Then we were identifying regular and irregular expenses, and we were able to identify an average arithmetical, and this amount, despite the age of the children, amounts to around 12,000 hryvnia, and this amount only covers 51% for the children under 6 years, and even less for the children from 6 to 16 years. We have a major part uncovered, 6,044 for the children from 6 to 12 years, and this amount over 12,000 hryvnias, it takes into account all of the basic needs such as meals and clothing, and the families, they spent the majority of their costs like to cover those basic needs, but they think about even more, such as recreation of the children. Also, there was a question in the questionnaire, what is the desired level to cover all of the needs? We understand the basic needs and there are additional needs, and this amount is twice bigger. As you can see, 24,836 hryvnia. What's important is that 75% of expenses are being spent for like basic needs such as transport, communication, and less than 7% of the costs account for coverage of the hygienic needs or the development needs of the children. And as we were talking to the parents, we were seeing that this need was not covered, and the parents have to look for the money somewhere else. It may be like for example, employment of only one family member, and on top of this social aid, the families also can get free services. And what we see on the screen is the percentage correlation. As we can see, there's the free medical examination for the children. Meanwhile, other things are not being used. Again, another problem is lack of awareness and complication of the procedure. So again, having free medical services, they can cover a lot of needs of the persons. It's not quite so, because they are unable to provide proper aid to the families. Also, I would like to mention the problems of the families raising children with disabilities. You can see their needs are different comparing to those families that do not raise children like this. But again, their requirements are higher, 3.2 times higher. And what was surprising to me is that a lot of people can't cover the needs of the children with disabilities, and about 28% of those surveyed cannot cover the recreation costs for their children. And when we were asking what would be the amount that could cover all of the needs of the children, it was above 31,000 hryvnia. That would be an amount to ensure the coverage of all of the needs of our children. So proceeding to our recommendations based on the results of the study. Again, the study was lasting from July to November. We were presenting the preliminary results of this study in July, and then this information was taken into account. Our recommendations include 3-component models. So what we suggest is to change social aid for the support of the children, and also implement 2 types of other aid, other disbursements. Talking about this state social help for the children. As I mentioned before, the actual expenses amount to 12,000 hryvnia per child, and when this amount was identified and taken into account by us, we were identifying the actual cost, the current costs, and the rate of difference between them. And based on that, we multiplied that rate by the one existing in the legislation, and it came as 5 for the children under 6 years and 4 for the children under 6 to 18 years, and this amount would be 14,000 hryvnia. Talking about the one-off aid for study, what we suggest to make a disbursement in amount of 15,500 hryvnia. We were analyzing some elementary needs such as stationery, digital devices, non-regular medical costs, footwear, clothing, and talking about the costs for children's support. It was mentioned by our experts. There's a lot of questions, when the children are being adopted by the families. So it's a matter of coverage of furniture for them and some other elementary things that are necessary, and this amount is around 26,000 hryvnia. We were asking the families what they would like to spend additionally. As you can see, there's a lot of answers about recreation. It's an important thing that should be taken into account as the children are being adopted from the very beginning. And again, talking about the children with disabilities, again, they were correct in rates suggested, and we suggest 3 types of aid: increase of the state social aid with an account of 2 types of rates, and as the children are being adopted with the families and as children enter the elementary school. So talking about children with disabilities, I return to this slide about the children without disabilities. What we're talking about now are the actual costs, the minimum actual costs that can cover the basic needs of the children. At the same time, it's important to be able to cover other additional needs, and in fact, the aid provided to the families would be twice bigger. We had to pay attention to this matter as we would be able to discuss these proposals. We have to take into account that the inflation rate may change, and those rates may be reviewed as well. And at this moment, I would like to thank you. You can find the full report if you follow the link behind this QR code. Thank you, Ms. Anastasia. Very well argumented and very concrete proposals. Talking about the financial aspect, Ms. Darya, we all understand that it's not about just hryvnias, it's about health, it's about welfare, it's about education and coverage of the basic needs, like Ms. Anastasia has mentioned. In your opinion, what needs to be done so that the state realizes the importance of investments in the future of our children, investments that our country needs now and which are so important for us to preserve so that they grow up good citizens of our country? Good morning, everyone. I think that the state knows and understands it. I think that the implementation of the strategy that we were mentioned today and the order of the president that popped up on the 24th on the president's website, it says that the problem is well understood. The question is where to get money for that. And now we're saying that during the war, and not only during the war, we need foster parents with resources, those who can raise their children. And it's an ongoing process, because as we talk about the family type foster homes, so we talk about them as professional parents, those who can adopt like difficult children. What I mean by difficult children is those who survived violence, those who lost parents, those who need the therapy. And let me remind you, there is another huge problem, because now the foster parents, the guardians, they have a serious delay with they experience serious delay with the disbursements, because back in May those payments were transferred to the social support fund, and the average period of delay is about 3 months. So we have to understand how those people are supposed to be feeding their children. Responsibility for whom the government delegated to them. As a children's city, all these years that we've been working in Ukraine, for 22 years, we support those forms of education, the foster parents, and we know what those families live with. We know about all their problems, and during the war we keep saying that we have to maximize the ability to have children adopted with their family type foster homes. And now our key problem is to preserve the existing families, to make sure that they are still capable of doing this incredibly important work. You've seen that 38% they may think that probably they don't have a strength to carry on, and there's another stigma that the families adopt children only for the money, and we demonstrate that it can't be done. People with their own resources, they invest in those kids. And also there's another analogy. I understand we have to talk quickly today. I know that there's a huge human capital, human resources forum taking place, which is attended by representatives of big corporations, businesses, the government. And now I have to remind you that our children is our human resources, and depending on the amount invested is the quality of those human resources. So it's important to find those funds, because really without investments it's impossible to make children grow and to stay in Ukraine. And we want the children to stay in Ukraine and to be involved in reconstruction of Ukraine. So once again, let me remind you that this study was a response to the strategy that was outlined, and also it will be a huge task of us as civil organizations to make sure that the next year probably we will hear about the opportunities that the state has to have those money budgeted to increase the payments for the families, because otherwise we have a chance to lose those families who raise our kids. Thank you, Ms. Darya. And now, Ms. Valentina, we would like to hear if the state has resources. I would like to ask you whether you see those recommendations covered by this study, such as those that can be really considered as the updated policy for the foster families is coming into effect. Well, I want to thank you for this question. I would like to thank, first of all, our foster parents, because those are the people with an incredibly big heart and soul, because they raise our children. They give them parents love and care. And as I talk to these parents, I look them in the eye and I see the fire of hope and incredible love that sometimes we fail to see in the parents raising their biological children. And their contribution is incredible. Recently we were meeting the foster parents, and they touched upon a serious block of questions we keep working on. And one of these matters was mentioned by Ms. Darya, the delays with payments. Now the child care service is coordinating it with the pension fund to understand what was the failure with the payments, what was the amount under received for which period. So we contacted all of the children's services. They've analyzed this information, provided it. Now this information is handed over to the pension fund, and the representatives of the pension fund process it case by case in order to remove those, mitigate those risks, those existing risk factors. That's the first block. Another block, the Ministry of Social Policy made amendments to the legislation in force to contemplate the disbursements for the foster parents for every single child being adopted. So those disbursements will be bigger compared to those they receive now, and they will come into effect since the 1st of January 2026. Another step the Ministry of Social Policy is working on is a matter of rest and recreation, because the matter of rest and recreation is really important both for our children, and now it's contemplated that the foster parents will be able to identify the institutions where their foster and biological children may come for rest and recreation. And within the strategy studied, I would like to thank SOS Children's Village for this study, for the results that will be processed by the Children's Care Service to take them into account in their future operations, because the civil sector highlights the problems for us that are important for identifying the further steps when it comes to state governance. And in the same way, we'd like to thank the foster parents for communicating those problems they're facing, but very frequently they also suggest the mechanisms of mitigation, what to pay attention to. And for us as the representatives of the government, it's of great importance. Thank you. Thank you, Ms. Valentina. Ms. Iryna, talking about coordination center, what was already done and what are the plans to improve the financial condition of the families who adopt the kids? Well, good morning. As it was mentioned here before, it's important for the civil sector to work in coordination with the reforms office, because any reform requires specifics, and in the context of a strategy implementation, one of the key tasks that we're facing is to identify the financial components, and it applies both for the foster parents and children's payments. And this study has become a foundation. The first steps were already made. Even the payments that were today mentioned by Ms. Valentina, before raising wages, we were using this study. We were forwarding it to the Ministry of Social Policy. What's possible to do now through resolutions, it was already done, but to raise the amount of disbursements, this initiative needs justification, because we can say that the funds are not sufficient. That's clear. We realize it. But why? And what is the amount? What is the potential funding model? It all requires additional analysis. And thanks to this data, we can understand what are the gaps in some specific cases of children who grow in the family-type foster families, or children with disabilities who grow up in the family-type foster families. We understand what is the situation in the country and what to do with this information. Previously, we've adopted the national plan on implementation of national guarantees. It's about social alienation, and now more than 40% of children across Ukraine don't have basic needs covered, such as meals, clothing. So it's understand that the level of poverty has grown across the country, and our families are ending up in difficult life circumstances, but at the same time implementing this system of care as we work with the development of family foster forms. As we talk to the foster parents, when you look at the data, when you don't have more than 50% covered, those families end up in difficult conditions, and for us it has become the most outrageous thing to get this data, so we could get them to our colleagues deputies, to different ministries, because all of the legislative amendments will require all of the branches of authorities to stand united and taking responsibility for education of the children. Without having this stable, sustainable understanding that you can cover the needs of the children is just impossible. At the same time, unfortunately, this situation, such tendencies, they exist not only in Ukraine but all over the world, including in European countries. The generation is getting older and they are not ready to take care of the children anymore, and at the same time the youth understanding financial stimuli and financial opportunities are not ready to undertake this responsibility. And some foster families, they even try to work. Family type foster homes are almost impossible. It's about 10 children and their main job would be to take care of the children. So for us it's critically important, and it's a priority, is to increase payments. That's why Darya was mentioning it about the president's order. At all of the levels this task is already identified, and without it it's impossible basically to implement any strategy to ensure children's right to be raised in the family environment. It's important for the psychological development, for the development of children's potential, and this family needs to be capable to raise children and to build capacity rather than saving on study and development or clothing or meals. And once again, I would like to thank our foster parents in the family type foster homes, because despite any challenges they still can find opportunity to develop the creative potential of the children, bring them to different activities based on the needs of the children, sometimes to different educational institutions, sometimes to specialized institution to cover their needs. But from the reform perspective, we understand that the development of family forms of education contemplates financial support and availability of the services. The services are supposed to be close to us. It has to be close to the families. We were discussing it with one of the foster mothers, and it applies to all spheres of life. The families don't have to wait for 40 minutes in case they call for ambulance should their children have any health issues. So once again, this study will become a foundation for our activity. In fact, we're already using it. We rely upon this information for the regional programs. For the time being, the regional military administrations have approved the regional plans of development to ensure the strategy to ensure children's right to grow in the family environment. And now the communities have started creating their local programs and regional programs, and I really want to thank the communities and the regions who are already implementing the support as the family type foster home is being created with the decreased resolutions. Again, the situation is difficult. The child poverty rate has grown during the war, but it requires the inclusion of everyone, and it applies both to the communities and to the existing budgets at the level of the regions, and obviously the state budget in general. Thank you, Ms. Iryna. Behind those figures, behind the statistics, are the real stories, the real families, And today we were thanking the foster parents who undertake this huge responsibility. Mr. Leonid, you represent the families who adopted the children. You are a father of 6 yourself, so you know from your experience everything that we are discussing today. To what extent the summary of this study correlates with your experience? What are the biggest issues the foster families are facing now? Thank you. I would like to thank the organization who organized this study. It's really actual. It's a really interesting and important project, and also thank you for the invitation. I can really give you a feedback based on those figures. You know, I'm a finance person by education. I know something about figures, so I like this multifaceted analysis. The only thing I would add that this study doesn't include the age category of the parents, and it would be sufficient to understand which age groups we're working with. However, this study demonstrates, I'm not going to repeat myself, that the coverage of such families by the state is not sufficient. It reflects on the quality of education and social services and the level of life of the family in general. But what I would like to draw your attention to, I was looking through those numbers on my way here, so I paid attention to the fact that 20%, 21% of the parents are retired. Do you see where we are? We end up in a situation when probably after 1 year, we will face a drastic drop in the number of such families. If now this number is decreasing 2% per year, now these figures are going to change. Within the next 5 years, those 21% will just cease to exist. I'm not saying about the people, but rather the foster families, and the youth is not coming, and we have it would be good to understand behind those figures what can we do as the state, as the society. Talking about the figures that were mentioned as desirable for functioning of the foster family in future, I think that's an adequate amount, because really talking about the state financial coverage or state disbursements to the parents, like wage, we were counting it that you get 17,000 hryvnia for every father and mother. Yesterday I came to work.ua website, and you can find job announcements there. A driver who works in the Kyiv municipal administration would make 18,000 hryvnia per month. Their responsibility is minimal, and then your working day ends at 1,700, unlike a foster parent who has a lot of responsibility and works 24/7 on raising their children. The youth is not going to come for such conditions. You know, those foster parents who are currently raising foster kids, we need to make sure that they are not being added to the register of the people living in poverty. They should enjoy some significant financial stimulation. Unfortunately, the pension for the foster parents is minimal, and their only financial contribution within those years was not sufficient, was not meaningful, and that's why they're going to get some minimum pension. And the fact that 20% of the foster parents and the guardians work, it means that they still can do it physically. They can carry this burden. So again, this study is really important. I've seen some outrageous indicators that tell me that we're losing this sector, I would like to wish to the state, not like the Ministry of Social Policy, but to the state on a more profound level. There's a lot more ministries and institutions involved. So not only take responsibility for the family force, but also to feel this responsibility, because to me it seems like the fostering is what the foster parents need, and the civil organizations who champion this matter. The state needs to be communicated that this is important, this is urgent, and they should not forget about it. And I cannot help but saying that as we were studying the problems that has arisen today, some parents don't get their disbursements for 3 months. I don't know how do they even survive. Only 20% are making additional salaries. And as we've started studying it, we started inquiring the pension fund, what was the amount of funded, or like how many families were funded back in September or August. The answer was such that the pension fund funded 100% within the period from July until October, but we know that the families are still not getting their money, and there is a collision. Why there is no responsibility if there is an issue? So let me put it like this. Thanks to the parents, thanks to their relatives, they get additional resources. Those people, they feel that responsibility, but the goal is to improve the conditions. We are going to champion this opinion that the amount of support should be increased. 14,000 is an adequate amount, because the lion's share of all of the money allocated by the state is being spent for utility services, for logistics, because not all of the families have access to social services. There's a lot of families who spend a lot for transport, for fuel. Let's not forget that every other family has a transport. That's a whole different topic. During the war, it became a matter of security and survivability. Not every family can afford sit in a car to drive to buy like a weekly reserve of meals, and that's what the lion's share of the support is being spent for. The majority is being spent for treatment, medical services. We understand there are no 100% healthy children in the system. Those who end up in our foster families, they all require treatment and rehabilitation. As an example, my younger daughter, we've been bringing her to massage specialists for 14 years. Those are not acute problems, but her health condition requires continuous treatment and rehabilitation, which is additional money, and we keep looking for it. So once again, thank you for an opportunity to address the audience, and let's keep in touch. Thank you, Mr. Leonid. Dear guests, dear colleagues, should you have any questions, please raise your hands and you will be handed a microphone. Good afternoon, Sergei Kukhtin, the head of the Future Foundation. I have a question to you. An IDP family from the front line, from Dobropilla, Donetsk region. They now reside in Odessa region, and the question is simple. Is there a final date when those under-received payments will be finally accrued? It's really important because they don't get children's support money. Currently, they're to try to survive on the subsidies, but that's still not enough. Mr. Sergei, the information is gathered by the Children's Care Service, and it's handed over to the pension fund. It's all added to the general list. If you can submit any information family by family, my personnel will check if the information was submitted earlier. Currently, I cannot give you any specific date, but shortly everything will be processed. The pension fund works actively in this area. The parents live in the pension fund rather than raising their children. Mr. Sergey, we understand it, but please understand us. We've collected that information not only for the sake of collection. We've collected it to make sure that every family receives their disbursements, and we're interested as the state to make sure that our foster parents, they receive their children's support. Thank you. Do we have any more questions? Okay, then let me ask another question. Now what we plan is the right approach to increase the funding of the families. There are specific rates suggested, as Mr. Leonid has mentioned, that's a well-argumented amount, but in fact every child, every family is a specific case. Is there a case-by-case approach being considered to every case, just like Mr. Leonid has said, given the example of his daughter, that there may be a need for additional medical treatment or other kinds of rehabilitation, like psychological rehabilitation, and for some that 14,000 amount will be sufficient, and others may need systemic needs and ongoing systemic needs. Is there such an option considered? Who can answer this question? Well, let me try to answer it. Well, in fact, every child has their own individual needs, and it applies to all of the children growing in Ukraine, both biological children and foster children. And the study of the methodology itself that was represented, it created a generalizing picture about what are the basic needs. However, we have to understand that it's not about cash. There is also care, and we have to unite one thing with another. For example, rehabilitation services are being funded at the expense of the Ministry of Health. There's a lot of different packages that the children may take advantage of based on their needs, and the same applies to education. The question is that for the time being there are individual challenges that are not being covered, or they are not contemplated in the financial support, and it was mentioned in this study that some fraction of the costs will be covered at the expense of the money, and some part will be covered by services. And it's important to join this financial support and this support by the services to the families on individual basis, because case-by-case approach is important. It's being implemented in the country, and in fact there should be an individual plan for every child development, coverage of their individual needs, and covering it with financial costs or other services such as social, educational, or other types of aid. Thank you. Ms. Darya, I would also like to comment. I think that in our study we were oriented at the average price or average cost which is supposed to be covered those needs, and it's important to understand that in some cases the families are not well aware about the needs of the children. They cover those needs that are obvious, the basic ones, but today we didn't touch upon the role of the communities where our guardian or foster families or family type foster homes reside. And in response to your question, the community where those children reside is supposed to be involved, because those are the children of that community. Today we've presented what can be implemented at the level of the stage, but as we talk about preparation of a child to the school, this financial responsibility can be undertaken either by the community or by the school. They are interested in having such families created. Is there a financial contribution to make sure that those families feel that they belong to that community? And there's a problem. There's a lot of children who still require complex support, children with disabilities, children who are staying in the institutional care facilities, because sometimes the people, they consider such an opportunity. They think, today I work, I have such costs, but tomorrow I don't work, I lose my job, and I cannot take quality care about my child. And again, as we talk about the money, they really correlate with the quality of care we're discussing, and it should be remembered too that it's not a secret for anybody that during the war, given all of the challenges, we see the growth of violence in the family type education. Why does it happen? Because the parents are exhausted, and in Children's Village we always deem that the family type foster homes are our partners. They're not our subordinates. We don't control them, we cooperate with them. And to talk to the families equally, we have to ensure decent payment for them, and then we can require for them higher quality of the services they provide. I agree. Iryna has said that today family type foster homes are the families in difficult life circumstances, and sometimes if I talk about those things at the absurd level, then we have to deprive the families of those kids because they may produce some harm of them. But within the last 3 months, we've helped one family, a foster mom who fosters 10 children. We funded a difficult surgery. Also, we are being addressed frequently by the parents who have children with oncology. Again, those children, they may lose their families once again, so we have to think about it now. Let me add really briefly, it's an important thing that currently we're living in debt. All our funding is aimed at support of the armed forces and function of our country, and there are no funds. There are funds that are provided by the donors, by the partners, and that funding today, I want to thank the civil sector. They are in fact supported the families, handed them over. In case with the state documents the priority, outlines the strategy, saying there is a need for such funds. We do not have sufficient funding to cover this or that need, but respectively we support the family type foster parents through this type of tools. Obviously, for the tools is being for the parents is being perceived as charity, either procurement of food or coverage of some needs. But again, it's a matter of dignity. For example, if it's not for the war, probably there would be other conditions, and probably we shouldn't have needed to provide aid in a way like this, but this aid is still being provided through charity support, and it's important for the children to see an example in their kids, in their parents. When the parents with their kids, they pick together which food to buy, which clothing to buy, which needs to cover, and it's important because being raised in the family is when you have a choice and you have a role model, a personal example. So for me, it's important to proceed to this stage where there are services, there is a choice that will allow the parents to be an example for their children and also how to financially plan the way your family works. Well, hopefully this time comes soon, thanks to those conclusions, thanks to the results that we were able to see in your survey. Well, let me remind you that we had a presentation of all Ukrainian study about the children deprived of the parents' care, and in 5 minutes we are going to have another briefing during which we will discuss the updates to the community capacity assessment to strengthen local development. Stay tuned.